Bismillahirrahmanirrahim. Assalamu alaikum. So in this video we are going to talk about the interface of the ultrasound machine. This interface is very easy to understand and remember, and we should always remember how things work, because these are also tell us about the directions, what are the directions, what are the x-axis and y-axis, and similarly how we can go superficial and deep, and what is meant by the words or the headings that are written onto the screen. So let's start from the top left. This is basically the time and date that you can see. This is the logo of the machine or the manufacturer, and this is the clinic name, Aqua Shoulder Rehab, and similarly you can also see the time, and ADM stands for the admin, that the person who's using this machine right now is using this machine as an administrator. This is the patient name that is saved from the previous scan. So let's move to the next setting. This is MI stands for the mechanical index, that what is the index of the machine at this level. So the cavitations or micro massage or things like that. So this is for that. So mechanical index is set to 0.07 and thermal index is set to 0.8. This is for the heat. The amount of heat that is generated in the tissue is 0.8 right now. 8L stands for the frequency, which is 8 megahertz, and L stands for linear. So RS is the model and musculoskeletal function is selected. B is your mode. B stands for the brightness mode, and FRQ stands for the frequency. In this particular case, this frequency is set to 8 megahertz right now. If we increase the frequency, and let's try to do so, so then we'll see that what is the frequency. Can you see now the frequency FRQ has changed to 11. So now we are working at 11 megahertz. Let's try to unfreeze this again and reduce the frequency, and the frequency is at 6 megahertz. When I decrease the frequency, you see these white lines of the screen. These white lines, let's go to this. These white lines of the screen, they increased at 6 megahertz, and they decrease when the frequency is different. For example, at this it was 11 and this is for 6 megahertz. So this is just the feature of the frequency. GN stands for gain, that we are working at only 30% or 30 of the total gain. If you want to increase the gain, I'm increasing the gain. You might see the overall screen is getting white. This is 100% or 98% gain. I'm decreasing the gain to 0, and now you see that even at the same frequency the overall screen appearance has changed. So this is just amplifying the returning signals or echoes. Now let's move to the next setting. This is E by A. This is a special setting or feature for your ultrasound beam, and it has 3 steps. So currently it is set to 3 by 2. And map, this is not important. Again, this is a probe feature which is not commonly used. D is for depth. This depth, it shows us that we are working at the depth of 4 centimeter maximum. So if you want to, let's say, take a needle and insert into patient's body, it will only go 4 centimeter deep. But what if I increase, this is the decrease in depth, which is 2 centimeter right now, and now I increase the depth and it can go as high as 14 centimeter. Now if you look at this video or this picture, you can see that on the y-axis the machine has changed the view and the depth has increased, and on the right side of this you can see this is 5 and 10, 11, 12, 13 and 14. So each small line shows 1 centimeter depth. And then we have this dr is again radius for the depth, which is not important for you. Fr is important, frame rate, that is the number of pictures taken per second or per unit time. It is 69 hertz. That means that we are going to take 69 pictures every second of any particular structure. AO stands for acoustic output, that you are using 100% of the 6 megahertz or whatever the frequency that you have used. You can also decrease this. Sometime you want to decrease this when you want to look for certain or particular structures. So this is the x-axis, that means you are going from superficial to deep structures. Now on the x-axis we have either one side can be called as the medial and the other side can be called as the lateral. Now this is important, that how we should identify which side is right or left or medial or lateral. This is very easy to understand, and remember that on every ultrasound probe there is a marker. If you see my probe, you might see this marker. I'll show you in the light also, that there is a marker or there is elevation on this side. This is the probe marker. You can turn the probe to other side and see that there is only one elevation on one side. So this tells you about the location of the marker. If your marker is to the left side and you keep GE to the left side, then this means that this side is the left and this side is the right. So you can make use of it by making it medial or lateral. You can also change it. For example, I want to reverse the marker. Now the G is moved to the right side. Over the screen you can see this GE is moved to the right side. This means now your marker should be on the right of the patient if you want to see the right side. And when you know the right and left, you can easily make what is medial and what is lateral. So you can also reverse this to the opposite side, and then, so this is x-axis and this is y-axis. Similarly, this is the acoustic output or the output of the ultrasound beam, that here you can see the attenuation. Like for example, this is 100% getting down to 90%, 80%, 70%, and ultimately 0%. So this zone is called the dead zone of the screen. You cannot see anything beyond this particular area. But again, there are particular ways in which you can amplify the signal or try to see something. And over here, this line, it shows you the total time, and it shows you 10.5 seconds, and from the 10.5 seconds you can see 822 images, and you can scroll this. You can see that this number is changing from 822, this number is changing to 760. Now it is, and you can see the screen also changing. So you are going, you can say, back in time. It is just like you are looking back in time. So here you can see very easily that at that particular time we were at this level, then this level, so we change the depth. So that's how it works. Now let's unfreeze it. The freeze is to stop everything. Once you freeze, everything will stop, and let's try to see. The first thing that I should select is the depth. I want to scan my abdominal muscles. I want to look for my rectus abdominis, external oblique, internal oblique, and transversus abdominis. These four muscles should be the target of my activity today. And I want to, let's say, set or check the right side of my body. So I'll try to reverse the marker. The G is on the right side of the screen now. That means that my probe marker should be on the right hand side of my body. The next thing is choosing the appropriate frequency, which you can also modify or change when you are working directly with the patient. So as a rule of thumb, remember that you have to take your probe and you need to apply the gel. So let's try to apply the gel onto it. As soon as I applied the gel, you can see the screen. Here you can see the gel has been applied, and now you can see the lines all over. So I'll try to place the probe marker to the right side and my probe on my anterior part of my belly. Now I can see some structures which I unfortunately cannot recognize without moving. So I have to make sure that I first get a particular point, the point I know to start with, and then I can progress to the opposite sides. Now because I'm exactly on the midline. My probe is just near my belly button. So this particular region, let me show you the layers. Wow, that is so beautiful image. Okay, this is very easy to understand and interpret. Okay, here you can see this zone is the linea alba. Okay, so we want to look for any particular structure. For example, this is the skin and abdominal fat, and this is only 1 centimeter. The anterior abdominal thickness or the fat is 1 centimeter, and below this 1 centimeter, you can see this fascia. And this is my right rectus abdominis. This is linea alba, this hyperechoic appearance, and this is the other rectus abdominis. And below this, you can see my intestines. So let's try to unwind it, and you might see the lower portion moving. When you see this movement, this is the intestine that is moving. Okay, so let's find out the rectus abdominis again in the midline. You can clearly point out at this white portion. This white is basically the linea alba, and from this white, this is my rectus abdominis. When I approach my rectus abdominis and go laterally, I should see three muscles, and here I can see three lines: external oblique, internal oblique, and transversus abdominis. As soon as I'm pulling my tummy inside, this is transversus abdominis that is working. So this black line is showing us that there is no ultrasound gel at that particular area. So when there is ultrasound gel, can you see these three muscles? This is fascia, one muscle, second muscle, then fascia, and the third muscle. So I'm just trying to contract my transversus abdominis muscles, and I can easily see the movement of these muscles. So that's how you can identify and see the convergence of all these muscles onto the fascia and then onto the rectus abdominis, and again from the rectus abdominis it is going to the opposite side. Now you see the black portion which shows that there is no gel, so we have to apply the gel again, and we need to scan the abdominal muscles again. See, look at the difference. As soon as I apply the gel, there is, and now you can clearly see all the muscles. So we are moving from midline to the right lateral side, and that's how it works. You can see all the muscles. You can go to different areas, and now you can see all three muscles again. And I am onto the almost mid clavicular line, or just lateral to the mid clavicular line. That's how it works. You can also see, let's show you or try to show you, if I can show you right now, the heart or the movement of the heart. Maybe we can try. This probe is not intended to scan the heart, but let's try to see if we can go through the intercostal muscles and reach heart and pick up some signals from the heart. So let's try to increase the depth, make it 6 centimeters, so the heart can be a bit deep, and we know that we need to look for fourth or fifth intercostal space or below the nipple. So I'm going to place this. Oh god. So here you can see my heart beating, because this is not the right probe, so I cannot angle it particularly, but you can see the movement of my heart very easily. So that's how they take the cardiac probe, or sometimes referred to as the phased array probe, and then they can work with these things. So it is not very difficult to perform. All you have to do is buy some equipment, keep on working with this. There are a lot of materials available. You can use them for reference, and you can see so many things. If I can, lastly, I can show you my, let's try to show you the movement of my radius when I perform the supination and pronation. So yesterday I've seen a patient whose pronation and supination was limited, and I did a scan, but I didn't make the video out of that. So let's see. I just have to place the transducer And now can you see this head of the radius moving? Is it worth noting? And you can also look at the annular ligament on top of the head of the radius. This white thickness is the annular ligament. So it's very easy. You can identify the nerves. Let's try to show you some nerves if I can. Here I found one. This is very easy, but of course you need to have an eye for to see this. You have to train your eyes. I can clearly find and see the nerve here. Let me show you where is my nerve. Let's try to freeze, and there you go. Now the nerve has a particular honeycomb like appearance in the ultrasound in the short axis. So let's this is the nerve, okay, and let's try to zoom in. Can you see this? The nerve is round and it's just like the hump of the camel. This is the nerve. So hyperechoic and hypoechoic lines or planes, and this is muscle. The muscle is totally different from the nerve, and this is the fascia. So you can identify or try to identify each structure based on their echogenicity. For example, this fascia is hyperechoic as compared to the muscles, or similarly you can say the muscles are hypoechoic as compared to the fascia, and the muscles are hypoechoic as compared to the nerve, and the nerve has a particular honeycomb like appearance. And then let's try to see the same nerve. Let's take out the zoom and try to find out the same nerve. Again the nerve is found, and now can you guys see the nerve, the round structure? And let's try to elongate it. Now the nerve is elongated, and now you can see these lines, parallel lines. Can you see?
Yes.
And with my flexion and extension of the wrist, I can clearly feel the movement of the nerve. So because I'm doing it on myself, it's a bit difficult to stabilize the transducer, but let me show you the tricks that you can use, or what are the movements of the transducer in more light. So first of all, this is the probe marker. This elevation is called the probe marker. If all of you can see this side, it has this line, but on the other side there is no line. So there is line on this side. This is the probe marker, and there is no line over here. So this corresponds to the position of this logo. So this is for the side. So right side or left side, you can make lateral or medial out of it. Now this is the footprint of the probe. We are using the linear probe, and when you apply the gel, you apply the gel onto this foot probe. Then what are the movements of the probe, or how to handle the probe? You must try to handle the probe like this. So this is, with other hand you can place the probe between your thumb and your index, and you can place it onto a particular structure. When you are scanning some structure, let's say like this, you can move the probe like this. For example, this is called tipping toe, and this is called tilting, and this is the rotation. So these are the movements, or sometimes you can also slide. So these are the movements of the transducer that you can do. And let's lastly discuss the few things that we have already discussed onto the ultrasound machine. So you have to make sure that you know all of these features. The freeze button is for freezing the image, so there is no ultrasound output and there is no reception of the ultrasound. This P1, P2 and P3, these are for your personal selection of the keys. You want to, let's say, set P1 for the print, or you want to make a screenshot, or you want to save image, so you can set these. P is for personal priority, that you can select any function. Then this is for depth, so you can increase or decrease the depth. Then this is for the reversal of the image. You can, when you press this R, the image is flipped from right to left. And similarly, you can screen two structures at the same time. You can compare right side with the left side very easily. You can freeze the right sided images or the videos onto right side, and you can freeze or save the left sided images onto the left side. So let me show you the right and left of Currently we are working at one window, there is no right and left, but as soon as I press R, you will see this selected window is right, and when I press L, this is for left. So you are working on the left, so you can compare right side with left side very easily. And as soon as you press again one key, it will be gone, and now come back to the machine interface. This is for scan area. This is your cursor. You want to place your cursor to some particular point onto the screen. This is for clear, zoom in and zoom out. This is for measurement. You want to measure some structures, you have to press this and take the measurements. These are your set and selection keys, so you can move the cursor with these, and you can also clear your comments or clear anything. And this is for commenting. If you want to write something onto the screen, let's say you want to write this structure is abnormal, or this is a sac, or this is something, so you can write a comment just like you write some caption onto an image. And then these are for ellipse and body patterns are to select the body part. You can make a short image or insert a small image of the body part that you want to scan. For example, you want to scan the upper extremity or the limb or the chest or whatsoever region. This is preset, so the preset settings or the functions I'll show you in a minute. These are the modes: B mode, CF, PW and M, motion mode, power wave, pulse wave and color flow. And this is for the gain. As soon as you increase the gain, you can see the screen. If I increase, let's say, the screen is becoming more white, and when I decrease the gain, the screen is becoming black. It's just like volume, and when you press auto, the machine automatically adjusts the gain. When we click onto the preset, these are the preset features or functions that we want to look for. Let's try to shift the light. Okay, so these are the preset features or the buttons that we want to see. So in this particular machine, we can, using this 8L or 8 linear RS probe, we can scan the abdomen, we can scan the obs, gynae, cardio, vascular. This is for urinary system or urogenital system, small parts and pediatrics. And when you select small parts, here you can screen the breast, the musculoskeletal, scrotal, small part and thyroid. So currently I've set this to musculoskeletal feature. This is sort of a setting in the camera. For example, auto, fast, moving, sports, whatsoever, there are a lot of features. So that's how you can select. For example, if I want to select the abdominal, it will load the abdominal features, and now everything onto the screen is changed. You can see the frame rate has changed and everything is changed. And now if I go to see the small parts, and I can select the musculoskeletal again, and then you can screen the musculoskeletal system. Then there are these special buttons available, and they are available on every machine. There is also always an audio, a brightness and some menu keys that you can work with. You can also store images, you can store videos, and you can play them, export them, save them based upon your machine. And this standard keyboard is for you to write the name of the patient and anything that you want to comment. And lastly, the probes that I have attached here, you can see this is 3C. That means this is a curvilinear probe, and it is convex or curvilinear probe, and this is usually for the organs or abdomen, and it is also called the convex probe. And the last probe, that is 8L, that shows the linear probe, and you can see that it is flat on the top. So I hope that this video is going to be useful for you guys. If you have any questions, do let me know.